Imagine your life without health care. Now imagine going through an entire pregnancy without health care before, during, and after birth. That's what many women of the early 1900s had to endure in the rural areas. Mary Breckinridge was the person who changed just that. Not only health care for women and children, but also health care of women and children in rural areas, and changed it to what it is today. I would like to inform you of three aspects of Mary Breckinridge. First, she is mostly known for her establishment of the Frontier Nursing Service, as well as the wide varieties of locations that she served, and the contribution she made to the modern healthcare comprehensive service across the United States. First, I would like to inform you of Mary Breckinridge's establishment of her well-known Frontier Nursing Service. She first established the service in 1925 in Kentucky in the Appalachian Mountains. According to Champeau and Kyle from the Mayo Clinic Proceedings, in 1925, Breckinridge organized the Kentucky Committee for Mothers and Babies in Leslie County, which in 1928 became known as the Frontier Nursing Service. Mary Breckinridge received many honors and awards during her lifetime, including an honorary Doctor of Law degree from the University of Kentucky. The Frontier Nursing Service served as a rural model, not only in Kentucky, but all over the United States as well as the rest of the world. The Frontier Nursing Service lowered the areas with the highest maternal mortality rates down to the lowest mortality rates across the U.S. Mary and her work served a wide variety of locations, so not only within Kentucky, but across the U.S. and as well as overseas. She volunteered as a nurse in France during World War I. According to Gina Casanova, while working in France during World War I, Mary was exposed to new healthcare ideas. Mary Breckinridge said herself, "After I had met British nurse midwives, first in France and then on my visits to London, it grew upon me that nurse midwifery was the logical response to the needs of young children in rural America. My work would be for them." She also served as a public health nurse in Washington, D.C. during the influenza epidemic. She also toured many nursing stations in the Scottish Highlands, touring the nursing stations to get more information from midwives overseas and to obtain more information about rural nursing. Mary also helped establish the first modern healthcare system to what it is today across the United States. According to Mary Breckinridge's ARH website, which is the Appalachian Regional Hospital, which is named after Mary, the state of healthcare in the mountains was transformed in 1925, while trained nurse midwife Mary Breckinridge was moved by the death of her two children, so she lost her son and daughter, founded the Frontier Nursing Service in Leslie County, Kentucky, to provide health care for children in remote rural areas. For years, Mary Breckinridge and her staff of trained nurse midwives could be found traveling throughout the Appalachian Mountains on horseback to deliver babies and offer health care for families in eastern Kentucky. So through the Frontier Nursing Service, she also started the first school of nurse midwives, which is currently known in New York City today as the Maternity Center. Mary also helped establish a hospital and healthcare center in Hayden, Kentucky in 1928, and also a graduate school of midwifery later there in 1939. So overall, along with Mary Breckinridge is known for her Frontier Nursing Service and the wide varieties of locations that she served, as well as the modern healthcare to what it is today. Now look at how far we have come with midwife services today. Look at how the maternal mortality rates have decreased because of the education and rural services we offer. All of this is thanks to the contributions of Mary Breckinridge. Thank you.